Health experts have long warned us about a possible surge in coronavirus cases corresponding with the flu season during the winter months. And now researchers are saying the flu shot may actually help prevent some of the most severe symptoms of COVID-19. News Nation correspondent Marky Martin live for us in Dallas with that story tonight. Marky?
Well, Joe, it's called the novel coronavirus for a reason. It is so new. There's still so much left to be learned about it, including what preventative measures we could be taking now to soften our symptoms later, if and when we do get diagnosed with COVID-19. But a new study coming out of Florida might just have the most interesting lead yet, and that is your flu shot might pack more of a punch than you think it does.
When we look at COVID-19 and the COVID-19 pandemic, up to this point, there really haven't been any good preventive measures about severity.
While the world may not yet have access to a COVID vaccine, researchers at the University of Florida Health believe Americans already have access to an injection that alleviates COVID intensity.
The fact that the effect was still so strong was probably the most surprising element of this.
Dr. Ming-Jim Yang and Dr. Nick Dorsey are on the team that conducted this study. They looked at 2,000 Floridians who had been diagnosed with COVID-19.
And we wanted to see if those people that had COVID, if they'd had a flu shot. And those that didn't have the flu shot were twice as likely to be admitted to the hospital and over 3 times as likely to be admitted to the ICU.
According to the CDC, about 52% of Americans were vaccinated last flu season, a percentage that has continued to grow the past 2 years. With COVID, we're likely to see that number rise even more. Both doctors underscoring that even if you've been vaccinated, masks and social distancing safeguards remain necessary.
I think one thing we have to emphasize is that it's not going to keep you from getting COVID-19.
Jimmy Kazin is one of those COVID patients who now wishes he had gotten his flu shot last season.
The difficult part of this whole experience is that we learn as we go.
He fought COVID-19 for 10 days inside a Central Texas hospital, simultaneously battling the thoughts telling him this was the end.
I might not make it. And literally, I felt a point of utter weakness, like there's nothing I can do here.
So in the wake of this new study, he was surprised to learn there might be a link. Other researchers on the UF Health team call the flu vaccine a double win in 2020.
We have a win that basically can keep people from getting influenza.
So in summation here, your message to Americans who have not gotten their flu shot yet, or even those who might have been anti-vaxxers in the past.
Please, 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 get your flu shot. It's going to be hard-pressed to find any clinician out there who will not recommend you getting the flu shot.
It does make you think. Now, in terms of where this heads next, where this study heads next, both doctors said they want to broaden their net to test more Americans, see how the flu shot affects more diverse groups of people. And I asked them, of everything, what's your biggest question in regards to COVID-19? They said what they're most curious to see and have answered eventually is what do the long-term effects of this virus look like in COVID-19 patients? Reporting live in Dallas tonight, Marky Martin, News Nation.